Hello, thank you for considering Paramount Bed USA as a potential partner to help you with your patient care needs. We appreciate your hard work, your dedication, and all you do for patients and patient outcomes. Today we are talking about the OBT D stands for dual, overbed table. So if you notice, there are two legs here. It's very versatile. It actually slides over the bed instead of under the bed, where there may be obstruction from a power drive, a wheel, or the bed's frame. So very versatile, easy to manipulate and maneuver back and forth. This promotes ease of use with various beds by eliminating the potential interference with that subframe architecture or the drive or steering systems. You can position the table where you want it, not too close or too far from the patient when they're sitting up in bed. So oftentimes with other tables, you get right about here and the leg underneath gets caught on something on the bed. Whereas this, we can bring it right to the patient, and the patient is able to utilize the table for whatever they were doing, whether it's eating or something using the tabletop. Other beds, again, you have to stop it from advancing, which prevents the patient having comfort and a gap quite often. As you can see, this has an extra wide tabletop. Extra space for you, the staff, as well as your patient. Additional room for the patient's things or for your things, the staff. Often we utilize tables on the side of the bed for our staff supplies. Also staff flexibility during bedside procedures because of that extra space. It's actually 15.7 inches by 50.6 inches. Nice thing about this is if you have a smaller room and you have an issue with storage of tables, this can actually just be stored at the end of the bed at any height that you would like it at. The brake function prevents unintentional table movement. This model does not show it, but there is also the potential to add the auto brake function. This has brakes that might help stabilize a patient while performing a bedside procedure. If I can have you go ahead and sit up. So the brakes are foot brakes. Might lock them in place. So let's say this patient was having a lumbar puncture, go ahead and lean over and push on the table hard. You can see there's stability in the table itself. Tables without brakes or the brake not locked could slide and present a fall risk to patients utilizing the table if they're standing or they're repositioning around the table and holding on to the table to reposition, entering or exiting the bed, and obviously a risk to staff if they're utilizing the table during patient procedures and it's not locked. We have locking casters and an adjustable height lever with gas spring mechanism. So the actual height can go from 32.7 inches to 45.3 depending on which model. Very simple. Push down. As the provider, patient also can adjust the table. There is a raised table edge. This decreases your chance of spills off of the table. There's also a retractable towel rack here. Goes in and out. And as we saw before, very smooth maneuvering of this table. And lock it. So very easy to manipulate and move around. The safe working load for this table is 66 pounds. Thank you for your time and all you do for patient care. For additional information, please contact Paramount Bed USA at 1-800-910-5703 or take a look at our website at paramountbed-us.com.